Today, by popular request, I'm doing a thread lift. Hi guys, welcome back to the channel. My name's Dr Sarah Tonks. I'm a cosmetic physician in London. Today I am going to be showing you how I do a PDO thread lift. This is something which I have not really covered on the channel so far, and that's really because simply I hate doing them. So I did them on TV a couple of times, maybe about 3 or 4 years ago. I did one on ITV This Morning and also on Channel 4's Bodyshockers. And after that, I got like just a ridiculous number of people coming in asking for a thread lift. So I've treated quite a few people using threads. And it's maybe because of that that now I literally despise doing the treatment. However, in some cases, I will pop a few threads in if I think that the patient requires it. And often that's when I have revolumized the face and maybe done some radiofrequency and ultrasound for skin tightening. Maybe I've done PRP as well underneath the eyes, and really I've sort of taken it as far as I can without doing something more invasive. Because let's not beat around the bush here, thread lifting is invasive and there will be downtime and there will be swelling and it will be really, really uncomfortable for a while afterwards. In fact, literally today I've had an email from a patient asking me to give her a ring because she had one last week and she can feel that there's some bumps underneath the skin and she's in some discomfort. So that is why I don't like doing it. I think sometimes people don't appreciate really what they are letting themselves in for in terms of the downtime. I mean, realistically, if you're doing this before an event, you really need to do it 6 weeks at least before the event. There's going to be a lot of swelling, there's going to be some discomfort for a good 1 to 2 weeks post-procedure. You might have difficulty in, say, turning your head because you can feel like the thread is catching somewhat. There may be pain when you're eating, chewing, speaking, laughing, and this can be persistent. And by persistent, I mean, 6 weeks maybe, something like this. Although I have seen it occur for slightly longer. Not sort of, constant pain. I just mean like the odd twinge people sometimes get quite a long time after they've had it done. However, what I will say about thread lifting is there is nothing else quite like it, non-surgically, to get lifting. So the principle behind thread lifting, well, there are two really. First is mono threads, which are short, single-stranded threads mounted on a needle. And when we use those, you put a bunch of them underneath the skin. And the idea is that you're trying to stimulate the body into healing itself and contracting the tissue. And they're the ones which we mainly use in areas of crepey skin, such as the neck region. Then you have suspension threads, and there are loads of different types of suspension threads out there. You've got barbed, you've got cogged, you've got 3D anchors, you've got heart-shaped, but they all have one thing in common, which is they're using the principle that when you put something in the skin, which has got like a little arrow in it, and then you lift it back, it's that stop which will prevent the skin from falling back down again. Some of the more popular brands over here would include Silhouette Soft, which is made of PLLA, and then you've got PDO threads, which are a different chemical substance, and they come in different sizes and shapes. So Silhouette Soft it's just a brand, and they have 3 different lengths, but the shape is all the same. Whereas with the PDO, there are literally maybe even hundreds of variations of brand, of length, of shape. And the important thing when selecting the PDO is to know, what's the provenance of this thread? Where is it from? I have heard of cases where unsterilized threads were used, people have ended up with infections and so on afterwards. And is this the right thread for the job? So aside from the monos and the barbed and other type of anchoring threads, you'll have ones which are specifically for use, for example, in the nose, which have a different shape. I personally don't use them. You've got spring threads as well. There are knotted threads which are twisted, different ones for different things. The two that I mainly use would be suspension threads and the mono threads. So when would I use a thread lift? Well, as I've said, it's really when I've sort of come to the end of the road with doing other injectables or other treatments. And for some people, they really just get this bee in their bonnet that they want to have a thread lift. And usually if a person has seen maybe some bad injectable results, you often see these in the media, they can often feel like, oh, well, maybe a thread lift or ultrasound or laser or radio frequency or whatever is the right thing for me. But for me, Botox and fillers, no thank you. Well, guys, really, it depends on how the Botox and fillers are done as to what your result is going to be like. So remember, all these things are just tools, and it depends on the person who's doing it as to what your outcome is going to be. So for myself, if somebody's got this concept that they really don't want to have other types of injectables, then I think we're not gonna get on a professional level, because it means that the person doesn't maybe trust what I'm saying in a professional capacity, and the chances are I've probably done a lot more procedures than they have. So I kind of know it's not my first rodeo, put it that way. Okay, so let's have a look at our patient. And if I was doing injectables, what would I suggest for her? Well, you guys probably know by now, I do some temple fillers, we definitely do some Botox, although you see the brow is peaking already in kind of quite an interesting way. So I'd actually want to drop that section down and lift this section up here. I do some PRP in the upper eyelid because the skin there is looking a bit crepey. I'd also do some fillers along the cheekbone itself and probably underneath the eye as well. We do have this bit of fatty tissue down here. You may be able to resolve that slightly by doing the filler in the cheekbone area and maybe lifting as much as you possibly can. It might still be necessary if you want a really good result, maybe to pop a bit of Aqualix or something which is going to dissolve that fat in there. See, we've got this chin crease here and a little bit of loss of volume sort of around that chin crease. It's almost like there's not enough volume in the chin crease and then there's too much volume on either side of it. So when you are doing fillers down there, you have to be super careful not to make the areas which are already volumized appear more volumized. And you can see the neck looks kind of crepey as well. So yeah, we'd have to do some skin tightening treatments there, maybe something like Jividen Volite as well. But what did we actually do? So when doing a thread lift, it's necessary to use some local anesthetic injections. And this is typically the same kind of anesthetic you would receive in the dental surgery. So I need to put the anesthetic in front of the ear at the angle of the jaw. And because I'm treating the neck, I'm going to pepper a little bit in the neck also, and also use some topical anesthetic as well in the neck. Due to the design of these PDO threads, when we are inserting them, if there is an area which is particularly painful, then it's possible to pass local anesthetic along the introducing cannula, so it can be directed at exactly the point it needs to be without needing to pierce the skin again. There is a lot of cleaning involved before you do a thread lift because you're essentially putting a implant underneath the skin. So the area has to be prepped really, really thoroughly. I can't tell you how many times I went over her skin. I typically use Clinicept for this, which is clear. That's why you can't see it. and I'll use that after I've gone over with a bit of betadine. So the first thing that I decided to do was use PDO straight to the neck. These are 27 gauge needles, and I think in total I did about 40 threads. So you put them in parallel to each other, and that's just so that it's possible to, keep account of where you've been and also be able to get them out relatively easily. Then I use the longer threads. These are barbed from in front of the ear to the jawline. And a total of 6 per side were put in. I then did the same thing from the angle of the jaw, going across to the chin and the mouth. And a total of 5 were put in per side. Then for the neck, I put 3 long per side. That's actually quite a lot for me. I don't normally put that many in. It's more typical that I will do maybe 3 to 5 maximum per side in one go. But, I thought we're doing it for a YouTube video. I kind of have to put enough in so that you guys are going to see a difference. But typically this would be broken down with me, maybe over 3 treatments. You'll notice with this type of thread that there's an entry point, but there's no exit point. So with a thread like Silhouette, there will be an exit point as well, but the shape of these is quite different. And then of course you have to cut the end of the thread. For the mono threads, it's not necessary to cut the end because it just tucks underneath the skin. So our patient, she had some swelling, she had some bruising. This is her 3 weeks later. I still think at 3 weeks, everything hasn't quite settled down yet for her. For me, I would love to get in there and do some injectables because all the same issues still stand. So I would still want to drop down this eyebrow and raise this section. I'd still want to put some filler across the chin crease. I think I'd also want to do the filler in the temple, on top of the cheekbone, and to the nose to mouth line as well. So if you look, it's almost like the face has been contracted slightly. So instead of the jowling making the face appear longer and more rectangular, by doing the threads, and lifting up the jowls, it's made the face appear a little rounder. And for me, I just feel like to counterbalance that, I would want to put some volume in as well. But I just thought it would be interesting for you guys to see exactly what happens when you just do threads on their own. If you look underneath the chin at the neck, I do think that there has been some improvement there in the skin quality. We don't have a super great picture to show you of that, but objectively in person, it did look a bit better. Funnily enough, we did go on to put some filler in, and I think in total we used 3 mils, but I don't have a picture of that. Okay guys, so that's it for this week. I hope you enjoyed the content. If you are thinking about having a thread lift done, you've got any questions or comments for me, you just let me know in the comment section below. I will see you guys again next week. Don't forget to subscribe to the channel in the meantime. I'll see you then.